taste of relief from pain.
We never knew something a doctor prescribed you could be a drug.
Can turn into a lifetime of craving.
We are not the hardest hit state, but that freight train's coming.
The opioid epidemic has touched every level of our society.
Every single time that I take a shift over a few days, I deliver a baby who is dependent on opioids.
It's taking lives.
Not many people make it this far.
And it's changing the way healthcare providers treat your pain.
There's no other area of medicine where you're worried about a cop coming to you.
But the increased scrutiny could be forcing some patients who really need this kind of medication to slip through the cracks.
You know, I don't know what the right course is, but I know this isn't it.
Thanks for joining us for this special report, A State of Crisis, South Carolina's Opioid Epidemic. I'm Caitlin Stansel. Tonight we look at the role doctors have played in creating the problem and the role they have in its solution. More and more research is being done to look at just how effective opioids really are in treating pain. Earlier this month, a report was published in the Journal of the American Medical Association, and this study looked at just how well opioids work on chronic pain over a 12-month span. Researchers found that for patients with moderate to severe chronic back pain or hip or knee osteoarthritis pain, despite the use of opioids, their pain was not significantly better after 1 year of use. Instead, it was the group using non-opioid medication like acetaminophen that you would recognize as Tylenol that showed that their pain intensity was significantly better. The study concluded that treatment with opioids was not better than treatment with non-opioid medications for improving pain-related function over 12 months. Opioids do have their place in healthcare, though, but we talked to a doctor in our area who detailed why it's sometimes difficult for doctors to suggest alternative methods of treatment for patients.
But it is really hard as a physician to mandate lifestyle changes. Often it's the lifestyle that led them to come to us. Certainly heavier people, smokers, all have higher rates of chronic pain. There's no question. But when someone comes to you with back pain and you're like, I want you to stop smoking and I want you to lose 30 pounds, and you pat them on the back and leave, that's probably the only time you're going to see that person. Again, you can send them to therapy, but again, that takes a lot of patient involvement too. They have to go, they have to continue to do the exercise. A lot of patients in pain have what we call locus of control issue. They feel that life is happening to them and they're not in control. And so they often don't exert a lot of control and can be passive. And they just sort of sit there and wait for you to come in with your magic pen and your magic pad, and you're going to do something to them and it's going to be okay. And that works, again, about as well as you expect it to, not very.
At the state level, lawmakers have mandated that prescribers use tools created to make sure that the patients they are serving are not doctor shopping. Just 2 years ago, the South Carolina Department of Health and Human Services started requiring providers to look at Medicaid members' prescription history before writing them a new prescription. They put strict consequences on doctors who do not use the South Carolina Reporting and Identification Prescription Tracking System that's also known as SCRIPS. And money talks. If a doctor fails to consult that program, they could lose Medicaid payments. With all the efforts, though, to curb the number of prescription pills that end up on the streets, some patients out there actually need this medication. And they say new regulations and laws are keeping them from getting the care that they depend on. We heard from at least 2 local doctors who said they are fearful for their patients' futures. Dr. Scott Sawyer wrote to me saying, quote, pain patients who are not addicted and obviously benefit from monitored opioid prescriptions are being involuntarily tapered downward or off of their beneficial pain medications. They are suffering inhumanely and some are committing suicide. Dr. Walter Evans echoed those sentiments saying, quote, I've witnessed the devastation in my patients' lives caused by the restrictive and heavy-handed policies of the DEA. Now, instead of giving these patients narcotic prescriptions which allowed them to lead active lives, I'm prescribing wheelchairs and other assistive devices to help them stay out of a nursing home. And a local man shared with me his wife's struggle with this very consequence of the opioid epidemic.
Yeah, they're dependent. They need the medicines.
Boyd Neely believes the battle against opioids is going in the wrong direction and hurting people who rely on them, like his wife.
A lot of people who need them legitimately have legitimate issues, histories of pain, are going to die also. And I'm worried about that. I'm very concerned about that because my wife has come close to that already several times. Had it not been for my son and I, she would have died. I don't know what the right course is, but I know this isn't it.
Neely says his wife has a history of pain and a list of conditions that have left her dependent on opioids to function.
She's a wonderful woman. She was a nurse for 30 years. She has the biggest heart of anyone I have ever met. I've been with her for 35 years, and I can tell you, she is not an addict. She is a person in pain.
Neely says his wife is being labeled as a drug addict by doctors and is unable to get the medication she needs.
I think we've been to at least 8 doctors. We were dropped by our doctor of 10 years. This is the kind of treatment that people are getting, and it's horrendous. And people are dying. You don't hear about those people because they're not, the people who are dying from heroin overdoses. That's the ones you hear about. You don't hear about, the veterans. You don't hear about the older people who are dying in their homes because they have no way to get anywhere. You don't hear about people who have been injured and cut off their medicines. Cut back, at the very least, cut back to less than a third of what they were taking.
He sympathizes with prescribers, though.
Between the government and the regulations they're putting on the doctors, they feel helpless. They feel scared. They don't want to lose their license, and I understand that. Somebody has got to fix this.
But Neely believes lawmakers are going in the wrong direction with their solutions.
It's just the biggest effort at reducing something that is just really not touching the problem. They haven't cut back on the heroin overdoses. What they have done is they have created a whole new black market. Prohibition didn't teach them anything. If people need things, if people want things, they're going to get it.
So what are lawmakers doing to combat this issue? I went to the State House to find out, and I'm going to share what one local representative had to say about the comprehensive approach being taken by legislators in the Palmetto State.
We are not the hardest hit state, but that freight train's coming.
The most unforgettable shows of our time were created by one man.
Nobody writes a melody like Sir Andrew Lloyd Webber.
Tonight, the biggest stars celebrate his legacy. Andrew Lloyd Webber, tribute to a superstar. Tonight on NBC. Easter Sunday, a live concert event.
I'm playing Mary Magdalene. She is the mirror of love in Jesus' life.
Pretty incredible to get to play Jesus Christ.
Jesus Christ Superstar, live in concert, Easter Sunday on NBC.
Don't miss out. It's the final days of Nissan Now. Hurry in for big savings on Sentra and Altima, both with automatic emergency braking that could stop for you. Standard on our most popular models. The technology of tomorrow, available today. This is your last chance to save on our entire lineup. It's time for an upgrade. Hurry in to Nissan Now. Event ends April 2nd. Save up to $4,000 on the 2018 Sentra, or save up to $11,260 on select models.
By now, you've seen the news. The drug and alcohol epidemic is here, affecting our friends and family. If you or someone you know is struggling with addiction, there is help. At Trinity Behavioral Care, you will find the best managed programs for treating substance abuse in a safe and healthy environment. Trinity offers help for adults and teens in Marion, Dillon, and Marlborough counties. Don't let an addiction ruin your life or the life of a loved one.
Trinity Behavioral Care will get anyone the help they need, any age, any financial standing. We're here to help you choose a better life.
State of Crisis is sponsored by Trinity Behavioral Care.
From the state level to the federal level, the opioid epidemic has been declared a public health emergency. In South Carolina, over the span of just 3 years, from 2014 to 2016, the number of opioid-related deaths surpassed the number of homicides. And while no single change in the law will fix this issue, legislators in our state house are trying to do what they can.
We are not the hardest hit state, but that freight train's coming.
This January, the South Carolina House of Representatives Opioid Abuse Prevention Study Committee released its recommendations to combat the opioid epidemic in the Palmetto State. They focused on a 5-fold approach, addressing access to treatment and services, education and training for prescribers and the public, the criminal justice system, prescription medication access, and community coordination.
It's such a widespread issue and affects families all over the place. It affects our crime, it affects our education, it affects the labor participation. I mean, the statistics are staggering how widespread this problem is. So for lawmakers and anybody in government or in a policy-making position, it's really important that they focus on this issue this year and that we do it right.
Representative Russell Fry says doctors play a major role in turning this epidemic around.
They are the keys to the kingdom in this effort, and we really need them on board and to help us make sure that we can tackle this issue in South Carolina.
He calls prescribers the first line of defense.
When we look at the data on how people start down this path, it's through excess pills. It's pills in their parents' medicine cabinets or their grandparents' medicine cabinets, pills that were not used, pills that you have 2 prescriptions for. So when extra drugs get on the street and are sold, that's how the problem starts, is little by little. It increases the problem and people become addicted really very easily on opioids. So the less pills that you have floating out there, the better we are in properly addressing the problem.
I mean, we have, the 5th largest county in the state population.
Representing Horry County, Representative Fry knows the impact of opioids all too well. In 2016, the coastal corner of the state claimed the most opioid overdose deaths, 101. That number was nearly double the next highest in the state, which was Charleston County, with 65.
What we see is a scenario where people believe that if a doctor prescribes the drug, that it must be safe. And the sad reality is that's not the case. And so the more that we educate people and give them those opportunities to know about the dangers and the risks of these drugs, the better we are at properly addressing the overall problem, which is opioid dependence and abuse.
Fry acknowledges that opioids have their place in healthcare, but the committee he's on wants to see a dramatic shift in how we perceive substance use disorders.
But the big thing and the important thing is that we're starting a conversation on how we can address it. And so no one is openly hostile to these solutions. They have been at the table working with us. They want to see the changes too. And so we're encouraged by that. And I think that's the important part of what we do up here is start that conversation. And I hope that we can finish that this year with some sound policy.
But to Fry, timing is everything in winning the war against this epidemic.
If we wait, the problem just persists and gets worse, right? I mean, so what we've seen is that the longer we hold off, the more it costs the taxpayers, the more it costs society, the more families are affected. I mean, this is a growing problem whether we want to deal with it or not.
A bill that would limit opioid prescriptions to 5 days was introduced this session. It's just one piece of the puzzle that lawmakers are working to put together to fix this problem. You can see the full list of bills that have passed and that have been introduced in our web story under the WMBF Investigates tab. Well, it doesn't matter what field of medicine a doctor specializes in, this epidemic has touched every sector of healthcare. And one local doctor is working on re-educating her fellow prescribers about substance use, treating it as a disease rather than the moral failing of a patient.
Chrissy Metz tells all next Access.
Tonight at 7:30.
Whoa! I think I got something here. What is it? I think it's a George Sink commercial.
It is! If you've been hurt, get 9 on the line. Call all 9s.
I'd introduce myself, but this isn't about me, James Hinchcliffe, famous IndyCar driver. It's about the Honda Dream Garage Spring Event, where all your Honda dreams can come true. Check out the CR-V, Motor Trend's SUV of the year. and the HRV both have style for the city and ground clearance for the country. The garage life.
The Honda Dream Garage Spring Event is on now. Visit your local Honda dealer today to check out 2018's best SUV brand.
By now, you've seen the news. The drug and alcohol epidemic is here, affecting our friends and family. If you or someone you know is struggling with addiction, there is help. At Trinity Behavioral Care, you will find the best managed programs for treating substance abuse in a safe and healthy environment. Trinity offers help for adults and teens in Marion, Dillon, and Marlborough counties. Don't let an addiction ruin your life or the life of a loved one.
Trinity Behavioral Care will get anyone the help they need, any age, any financial standing. We're here to help you choose a better life.
Hey, Dad. Something's up with the Mustang. It won't go over 65. Oh, really?
How do you become America's best-selling brand?
Mom, something's up with the Fusion. The stereo won't go very loud. Really?
Dad, when I'm in the Escape, all my calls go straight to voicemail.
Really?
With My Key, you let parents stay in control even when they're not there. That's Ford, America's best-selling brand. Now get 0 for 72 on a 2018 Fusion or lease one for just $199 a month for 36 months only at your Carolina Ford dealer.
Lazy Boy Furniture Galleries has redesigned furniture shopping, so you get a hassle-free, no-pressure experience in a relaxing environment. Yeah, it's nothing like this. Don't miss Lazy Boy's Super Saturday sale. This Saturday only, you can save 30% on everything in the store. Plus, you'll get 0% interest financing for 36 months.
Say sofa!
Lazy Boy Furniture Galleries. Live life comfortably.
It's a beautiful day on the course. He's on the 9th hole. He's going to be using his 9-iron with only 99 yards to the green. All nines. Kind of sounds like a George Sink commercial.
It is! I'm attorney George Sink. Hurt in a car wreck? Call all nines now.
Live, local, late-breaking coverage on WMBF News at 11 with Meredith and Eric.
Changing the way doctors deal with substance use disorders and prescribe opioids is a mission of one local OBGYN. It might seem like she doesn't have a dog in this fight, but in reality, she sees the devastating effects of the opioid epidemic firsthand.
I am seeing young women, older women, women who are professional, and babies die from this disease every month.
Dr. Marla Hardenberg's passion for re-educating doctors on their role in the opioid epidemic is hard to miss.
They're not dying from breast cancer. They're not dying from cervical cancer. They're dying from untreated substance use disorder in numbers and devastating consequences for this community and families like I have seen nowhere else.
Hardenberg likens opioid addiction to a disease, a disorder that can be screened for and treated.
And because we, and culturally, sometimes are geared towards seeing substance use disorders as a moral failing and not a medical disease, we're asking the police to be that bridge. We're asking sometimes other groups or supports to be that bridge, when the most effective way to do that is for the healthcare provider to be that bridge.
She started a nonprofit called SAIL Initiative to address substance use disorders by reconfiguring the way healthcare providers address the issue in their clinical practice. She's also working to provide sober living housing for women recovering from substance use or dependence.
And I see what this epidemic has done to families, to mothers, to babies, all throughout that journey. And when I know that there is treatment that can release these people from this devastating effect of this deadly disease, to stand by and not make available a bridge between the disease and the treatment is not being of maximum service. If I see it and I don't do anything, I'm guilty too.
Hardenberg says the science is there to support her cause.
There's doctors, mid-level providers also, especially if you were trained when I was trained. We didn't understand as much about substance use disorders and how it was a disease and had genetic predisposition and exactly what's going on in the brain that creates the phenomenon of craving, and we understand all that now.
Hardenberg hopes that her organization will show doctors what role they play in stemming this epidemic before it takes even more lives.
Once we spend the time and the money that we need to spend at state and federal level to educate providers about what is the disease, what is a substance use disorder, how do you screen for it, how should we be prescribing controlled substances, how do you do a brief intervention. If I failed to screen for breast cancer, or I gave you the wrong medicine for the wrong amount of time, or I failed to send you to a doctor to give you chemotherapy, that would be gross negligence. This is no different.
Dr. Hardenberg emphasized that alcohol abuse is also a part of this substance use disorder. And again, she believes this is a preventable and treatable disease with the proper intervention from healthcare providers. From doctors here at home to the ones working on the national front, in just 3 minutes, hear from the head of the American Medical Association, who is also a local doctor, about his efforts to curb the problem with Congress's help.
Car wreck?
Don't scream, call Akeem.
We got a $400,000 settlement for a client who was injured when a driver fell asleep.
Call 8 million now.
To get your attorney, dial 843-8-million.
To quickly find all my grocery items, I always come to KJ's Market. IGA always saves me time and money. The Simply Done section's a lifesaver. What? They've expanded their products to include all my everyday needs? From paper goods to laundry items, all in one place. Quality ingredients at great prices. I just turned Simply Hectic into Simply Done. By now, you've seen the news. The drug and alcohol epidemic is here, affecting our friends and family. If you or someone you know is struggling with addiction, there is help. At Trinity Behavioral Care, you will find the best managed programs for treating substance abuse in a safe and healthy environment. Trinity offers help for adults and teens in Marion, Dillon, and Marlborough counties. Don't let an addiction ruin your life or the life of a loved one.
Trinity Behavioral Care will get anyone the help they need, any age, any financial standing. We're here to help you choose a better life.
Have a great day.
Ready, babe?
Yep.
How do you become the most trusted brand of SUVs?
We've got room.
You make it for those who are running a bit late, run into a little trouble, or might just be running low.
Alexa, tell Starbucks to start my usual order.
That's Ford, and that's how you become the most trusted brand of SUVs. Now get Escape or Explorer with 0 for $60, or lease Escape for $209 a month, or Explorer for just $289 a month.
Join us for the annual Fuel the Future Party at the Members Club at Grand Dunes Resort on Friday, April 13th. This great event helps fund scholarships for local students attending Coastal Carolina University. Show your support by attending Fuel the Future Party on Friday, April 13th at the Members Club at Grand Dunes. Fuel the future for local students by joining Sparks Toyota and Bradley Development for a fun evening featuring the band Diversity. You don't want to miss it. For more information and ticket information, visit sparksclassic.com.
If you've been in a car wreck, the Nastapool Law Firm will fight for you. We got a $600,000 settlement for a head-on collision.
Call 8 million now.
Don't scream, call Akeem.
To get your attorney, dial 843-8-million.
State of Crisis is sponsored by Trinity Behavioral Care.
Most of the patients don't wake up in the morning, I want to go get addicted to heroin, or I want to get addicted to fentanyl. They wake up with some unmet need that we need to address as a chronic medical condition, not the stigma of, oh, you're seeking pain, or the stigma, or you're an addict or something. So we need to remove the stigma of pain and the stigma of the substance use disorder patient and allow them treatment so they can get better. It appears to be our best bet at addressing this public health crisis.
Dr. Gerald Harmon has a unique perspective of the opioid epidemic. He's a local doctor, but also the head of the American Medical Association. The AMA has come up with their own guidelines for beating the opioid problem. Dr. Harmon acknowledges the role doctors have played in where we are today in this epidemic, but he also believes there's a fine line between fixing the problem and not hurting the people who need this kind of medication.
When I can't give them what they need, when I am handcuffed, oh, that's a rotten feeling to see them suffer and to see their loved ones say, Dr. Harmon, can't you do something no more? I couldn't prescribe it, or if they can't get to it because it's not available and they run out on Sunday afternoon and all the pharmacists said, oh, I can't give you any more because you've already filled your allotment. Then we have to be careful in our zeal again to do the right thing for the majority of Americans, that some of those people don't fall through those cracks.
So what is the solution? How do you help those suffering with addiction and those suffering because they can no longer get the medication they need? As you've heard over the course of the past 30 minutes, no simple answer exists. It's a complex issue, and it's taken about 2 decades to get to where we are in this epidemic today. So it's certainly not something that's going to be fixed overnight. But there are people out there looking for solutions, and if you've missed any part of this special tonight, you can head to our website, WMBFnews.com, find a link to this full investigation under the WMBF Investigates tab. And you can also join us right now on the WMBF News Facebook page, where we're going to be having a live conversation with an addiction specialist from Trinity Behavioral Care. She's going to be answering your questions right here from the WMBF Newsroom.